So first of all, what we're going to go through, guys, is what to expect in your exam. Okay, so of course you're going to have two papers. You're going to have paper 1 and paper 2. Okay, both questions or both papers are going to have resource questions in there. Okay, so of course, obviously in your paper 1, some examples of the resources can be, for example, your equations. Okay, so for example, your steady state concentration equations, particularly when it comes to calculating the dose of the digoxin, whether it's going to be oral or IV, for example. Okay, you're going to have additional resources up to 25% of the questions. That doesn't necessarily mean 25% of the paper is going to be SPC questions or even resource questions in general. Okay, it's only up to 25%. Okay, but also not every resource question is actually going to be an SPC. So guys, what have you seen in past papers? What other resources are you going to be expecting in your exam? Because we're going to go through this and I'm also going to give you some top tips as well before we go smashing into our SPCs. So when you're looking at past papers, what sort of resources have you seen? What are the type of things that you would expect in your exam, guys? Fantastic. You have seen guidelines, BNF monographs, yes, BNF extracts, fantastic. Pictures, opioid conversions, yeah, smashing, okay? You're hitting the nail right on the head, okay? So the first thing here is going to be photographs, okay? So photographs is going to be very common in paper 2 papers, and it's either going to be, for example, to identify the condition, or it could be for you actually to establish what the most appropriate course of action is going to be. So as we can see here, the lady has got what eye condition, guys? I may as well, I'm an OTC and MEP lead. I may as well ask you an OTC question whilst I'm here. So in terms of yeah, fantastic, is subconjunctival hemorrhage, fantastic. Okay, so it could be that you have to identify the condition, or actually advise on the most appropriate course of action. Okay, you can also have dosing information and conversions. This comes up a lot. Okay, comes up a lot in the GPhC exam, both in paper 1 and in paper 2. I had it in my exam in July 21. Okay, in my exam, I had it in both paper 1 and paper 2. Comes up very, very often. Okay. So you can also have dosing information as well. So of course that can be either in in paper 1 or in your paper 2. Okay, so also drug charts. Okay, drug charts. Okay, this is also going to be most commonly going to occur in your paper 2. Okay, and this obviously it can be for a variety of things, whether you have to identify what's actually wrong with that patient, if you need to stop a medication because the patient's been admitted into hospital. They're like some classic examples, you know, of these sort of questions that can come up in terms of your resources. Okay, lab results. Okay, really, really important. This came up as an extended matching question in my exam in July 21 paper. And it's always going to be because of electrolyte questions. Okay, so you have to look at the lab results, identify, you know, what the electrolyte abnormality is. Is it hypokalemia, hyponatremia? Is it hyperkalemia? Okay, and then you have to identify what has actually caused the abnormal biochemistry result. Okay. And of course, you're going to have supply lists, MHRA recalls, or BNF extracts. BNF extracts are often in the exam, typically because of those conversions. Okay, so for example, there's going to be things like your citalopram tablets to your oral drops, phenytoin sodium to phenytoin base. Okay, and also Priodel tablets to Priodel liquid. Okay, where would you find that information? In a BNF extract. Okay, let's save your time in the GPhC exam. If it was going to be a question about that sort of conversion, where in the BNF would you find that information? Where would you find that information, guys? It's always going to be in the one place. Okay, the BNF extract, the format of it never changes. It's always going to be in the one place. Okay, and the one place where it's always going to be is going to be under your dosing information. If you have your dose information, your BNF extract, your dose conversion is always going to be just underneath there. Okay, so if you have a question, Yeah, fantastic. Bottom of the indications monograph. I think I have a little bit of delay in here with you putting your answers through. Okay, so you got bottom of the indications monograph is always going to be there. Okay, so if you're having that sort of question, just click down to that section. Bob's your uncle. You can actually solve that question very, very quickly. Okay, fantastic. But of course, we're going to be having SPCs. Okay, you are going to have an SPC in your exam question because the GPhC like to put it in there. So, how many of you feel like this when you have an SPC question come up in your mocks? How many of you feel like this? Also, this is a fantastic TV program to watch. If you haven't watched The Office, okay, I highly suggest you watch it. Definitely suggest that you watch it. Okay, so if you do feel like this, yes, we're getting me's, we're getting me's, we're getting me's. Fantastic. Oh, me every single time. Okay, hopefully by the end of today's session, you will not going to be doing a Michael Scott no. Okay, I want you to be doing a yes, lots of smiley faces. Okay, and you're going to be going in there. I have to admit, I've only ever watched the US off. I've only ever watched the American version. I need to watch the UK version. But okay, so yeah, okay, I get it. Okay, hopefully by the end of the session today, okay, there's 210 of you on here watching. I'm going to help you actually kind of like smash your SPC questions. Okay, because the most important thing is do not learn the SPCs. Okay, do not learn the contents of the SPC. Everyone goes, do I need to memorize SPCs? Do you need to memorize it? No, because you're not expected to be a walking encyclopedia. The GPhC do not expect that of you. It's not a useful way to spend your time. Okay, you need to study smart. Okay, when it comes to kind of like these SPC questions. Okay, now there's going to be two ways in which you can tackle the SPC question. Okay, number one is to understand the structure of the SPC. So it's very easy for you to navigate through that document. Okay, and you will understand what I mean in the moment. Okay, or you can use the search icon. Okay, so or you can use the search icon. Okay, but you need to search smart, not hard. Okay, you need to search smart, not hard. Okay, but the GPhC do love to add an SPC question in. And the most important thing here, guys, is to basically don't be scared of SPC questions. Okay, treat an SPC question as you would if you had a patient in front of you in your pharmacy, whether it's a hospital pharmacy, community pharmacy, GP practice, wherever. Okay, in practice, you wouldn't need to. In practice, you're not going to read the whole 20-page document, are you? In order to get your answer, you're going to navigate through that SPC to get your answer. Okay, the GPhC do not expect you to read the whole SPC. That is just a waste of your time. Okay, it's important for you to understand the structure of the SPC so you know where you can pinpoint that information. Okay, and so there's a certain way and a certain mnemonic, okay, that I have in order to understand the structures of the SPCs. Okay, so Torsif says Control F. Okay, I will tell you today that Control F does not work in the exam, but there is a search function, but we will go through that. So I'm going to teach you two ways in terms of actually tackling these SPC questions. Okay, and whatever, I'm going to teach you two methods and you pick whichever one suits you. Okay, so I'm going to teach you two methods. Whatever you find more comfortable, you stick with it. Okay, so if you are ready to understand the structure of the SPCs and you are ready to actually understand method one of how to tackle the SPC questions, give me a one. Give me a one for method one, guys, if you are ready. If you are ready to understand the SPC structure, can you give me a one, guys? Okay. I have a mnemonic to actually help you to remember the SPC structure. Fantastic. We're getting lots of ones, lots of ones, lots of ones, lots of ones. Fantastic, fantastic. Lots of ones, lots of ones. Fantastic. Okay, so here is my mnemonic. You're probably thinking, what on earth, Georgina, are you even talking about? Okay, to understand the structure of the SPC, the structure of the SPC never changes. It's only the information that changes inside the contents of it. So the structure of the SPC goes by follows: nutty chemist fed croissants, okay, followed by psychopaths punched Albert Einstein dramatically. okay? You're probably thinking, what on earth are you talking about? Absolutely bananas, okay? So in the YouTube description, guys, I have actually got an SPC of finasteride, okay? Are you guys able to open it? Can you give me a 1 when you've actually able to open it, guys? Because I want to explain the structure of the SPC whilst you are looking at an SPC to help your understanding. Can you give me a yes if you can actually open up the SPC finasteride 5 milligram tablets, which I have popped into the description? Okay. Let me know when you're all ready, guys, and I'm going to start going through this structure for you. Fantastic. We're getting some ones. We're getting some ones. Yeses, yeses, yeses. Fantastic. Okay. So let's start off with Nutty Chemist Feared Croissants. Okay. You're looking at, you've got your finasteride 5 milligram tablets, you know, SPC open. Okay. And of course, Nutty is going to stand for name of the medicine. Okay, so of course you're probably thinking, duh, obviously. Of course, the name of the medicine is going to be finasteride 5 milligram tablets. Okay, then you've got C, which is going to be your composition. So Nutty Chemist, so that's going to be, so C is going to be your composition. This is going to tell you what each tablet contains. Okay, it's going to tell you that each tablet is going to contain 5 milligrams of finasteride. Okay, but it's also going to tell you key excipients. Okay, when I say key excipients, this is really going to be important. Okay, particularly with sodium and lactose. Let's say, for example, a patient was lactose intolerant. Okay, in the scenario in your question, or if you need to know your sodium content, for example, in calculations, if you actually need to calculate the percentage RDA of sodium. Okay, it will be written in the composition section here. Okay, this is where the key excipients are actually going to be. Okay, your full list of excipients is going to be later on. Okay, but don't stress about that now. You need to know that your key excipients is going to be under your composition here. Okay, then you've got Nutty Chemist Sphere, so F is going to be for form, and that's going to tell you if it's going to be a tablet, if it's going to be a capsule, what shape is it, okay? So for finasteride, when you're looking at your SPC in front of you, it's going to tell you what a tablet looks like. It's a blue tablet, it's oval, biconvex. It's going to have a 5 marking on one side and an FIN marking on the other side. Okay, there's also going to be clinical particulars. So this is going to be your chemist, so Nutty Chemist Feared Croissants. So that's going to be your C, that's going to be your clinical particulars. This is a key section in the GPhC exam, absolutely key. Okay, many GPhC questions will have answers in this section of the SPC. Okay, many questions will be based on this section. Okay, so what's in the clinical particulars? Okay, what's the medicine used for? Your therapeutic indications, posology and administration. So basically, what's the dose of the medication? Okay, is the dose going to be affected by hepatic and renal impairment? If there's dose changes because of hepatic and renal impairment, it is going to be in this section. Don't waste your time scrolling up, down. It's going to be in this section. Okay, is the dose going to change if it's a child, if it's an elderly patient, and how do we administer that medication? Contraindications, it's going to talk about contraindications. Like finasteride, it's going to be contraindicated in women and children. Okay, and you're going to have warnings. Okay, so for example, finasteride increases your prostate-specific antigen levels, and therefore that's something we need to take into consideration with our reference ranges when testing this in patients. Okay, drug interactions. Okay, it's going to tell you if there's going to be any drug interactions. Pregnancy and breastfeeding. Can you use it in pregnancy and breastfeeding? No. Okay. Are you able to drive with the medication? Does the medicine make you drowsy? Side effects, big exam topic. I had this as a question in my exam in July 21. It will ask you about the frequency kind of like of the side effects. So for example, it could be like, which of the following side effects has a greater than 1 in 10 chance of happening, where 1 in 10 chance means it's going to be very common. Okay, and the top tip for you, if you're struggling to remember the frequencies in relation to whether 1 in 10 or 1 in 10 to 1 in 100, 1 in 1,000 to 1 in 10,000 is all going to be in the SPC. Okay, all going to be in the SPC. Okay, and it's also going to tell you about overdose as well. Okay, so that's going to be your Nutty Chemist Feared Croissants. Moving on to basically in terms of psychopaths punch Albert Einstein dramatically. Okay, this essentially kind of like, I wouldn't stress too much about this section of the SPC, okay? Wouldn't stress too much about this at all. You've got your pharmacological properties. That's going to tell you about your pharmacodynamics, how the drug affects the body, and your pharmacokinetics, so your ADME, your absorption, distribution, metabolism, excretion, okay? Very, very unlikely you're going to get a question on this in the GPhC exam. Very unlikely, okay? The GPhC would much rather test you about indications, your doses, okay? If the dose is going to be impacted by hepatic or renal impairment, and your side effects, okay? And your warnings. Pharmaceutical particulars, okay? This is where it's going to give you the full list of your excipients, okay? It's going to tell you about your shelf life, any incompatibilities, any storage requirements, okay? Any special instructions for disposal as well. So, for example, pregnant women cannot handle crushed tablets of your finasteride. Nature and the contents of the container, it will tell you the pack size. Are they going to be in the foil blister packet? Some medicines have a desiccant in them, okay? For example, your Nicorandil, you don't cut your Nicorandil, okay? And of course, obviously, kind of like your storage is going to be under your pharmaceutical particulars, okay? So it tells you about any storage requirements. It's going to be under your pharmaceutical particulars. Okay, so authorization and date, don't care about these guys. Do not care about authorization and date. The GPhC are not going to tell you when did the MHRA authorize finasteride 5 milligram tablets. You know, they've got better things to be asking you about that. Okay, so like I said, guys, the key part of the SPCs is going to be your clinical particulars. Okay, does that make sense so far, guys? Give me a 1 if that makes sense so far, guys. If that's actually helped you to understand the structure of the SPCs a lot better. Give me a 1, give me a 1. So what you can do is that now, if you understand the structure of the SPC, if you have a question about therapeutic indications, you can go straight to clinical particulars, go to basically your indications, boom, Bob's your uncle, there's your answer, okay? If there's a question going to be about side effects, you can go, right, that's going to be under clinical particulars, under undesirable effects, boom, there's my side effect information, okay? So fantastic, we're getting lots of 1s, fantastic. Nicole says 1, fantastic, fantastic, fantastic. Michael says 1, Haley says 1, fantastic. Grace says 1, fantastic, fantastic. Okay, so let's do a little bit of a recall quiz. Okay, in what section of the SPC would you find side effect information? Where would you find it in the SPC? If the GPhC exam asked you about which one of the following side effects is a common side effect or an uncommon side effect or a rare side effect, where would you find this information? So in terms of side effect information, where would you find it? Fantastic. You will find it under your clinical particulars. Fantastic. Under clinical particulars. Clinical particulars, fantastic. Oh, fantastic. 4.8 going into pros here. Fantastic. Clinical particulars, fantastic. Okay. In what section of the SPC would you find the list of excipients? Okay. So let's say, for example, I am lactose intolerant. Okay. Okay. Or I could simply be a Tiva diva. If I was a Tiva diva and I didn't want certain kind of like excipients, okay, where would I find that? Fantastic. You'll find it kind of like in fantastic. You can find, yep, so you find, yep, you can have your pharmaceutical particulars. Okay, you can find some key excipients in your composition. Okay, so for example, sodium content is going to be under your composition. It's just a quicker way for you to find it. Okay, fantastic. Oh, so my answers there. Sorry, guys. Okay, so in terms kind of like of if you're not too sure if a medicine needs to remain in its original packaging, okay, where would you find this information? Where would you find this information if you're not too sure if it needs to stay in its original packaging? Where would you find it? Fantastic. Pharmaceutical particulars, your pharmaceutical section. Fantastic, fantastic, fantastic. Pharmaceutical. Smash it. You're killing it, guys, okay? If you are not too sure how drug X gets administered, where would you find that? Okay, if you're not too sure where drug X gets administered, so let's say, for example, you had a junior doctor and it was basically about like, oh, we're not too sure how to administer this drug, where would you find that information? Okay, yeah, so you've got 4.2s, we're getting 4.2s, 4.2s. Yeah, it's going to be under your clinical particulars. Yeah, fantastic. It's going to be under your clinical particulars, okay, under posology and method of administration. Fantastic, fantastic, guys. So, most important thing here, guys, okay, if you don't want to go through kind of by understanding the structure of the SPC, you have a search function tool. Okay, you have a search function tool in the exam. Okay, so this is a screenshot that I've actually taken from the test on the GPhC website of the Surpass system. Okay, so when we are looking kind of like at our SPC question, the GPhC is going to tell you there is going to be an extract of the SPC. Okay, it's provided below. You click on your resource, which I've highlighted in red, and it's going to bring up your resource on the left hand side. Okay, one important thing for you to understand here, guys, that Control F does not work. Okay, you use the search tool. Okay, it's a magnifying glass. Okay, and it's going to be right up where my arrow is. Okay, it's just before the zoom on your actually PDF viewer in the exam. Okay, so look for that magnifying glass. If you rather search, look for this magnifying glass. Okay, and remember, you need to search smart, not hard, which I'll explain in a moment. Okay, so remember, Control F does not work. You use the search tool. The principles of the search tool is exactly the same, okay, as Control F, but you've just got to click on that magnifying glass. It will pop up with the text box, and there you can go typing away. Okay, is that all okay, everybody, so far, guys? Give me a 2. Give me a 2 if that's all okay, because then I can now talk about in terms about searching smart, not hard. If that's all okay and you're happy about there's going to be a search function tool, okay, you will find I've had lots of questions kind of like on Telegram regarding like, well, it is not in the test function, so where am I going to find it? It's not, okay? It is not, okay? It's not in the test questions, okay? It is not in the test questions. The GPhC have said it is not in the test questions, but it will be in the exam. Okay, so I hope it'll be easy to find. It will be, because it's going to be right here, just where I've popped my arrow. Okay, your search function is going to be here. Okay, fantastic. Okay, does it work on the sample one? Okay, the sample questions, okay, it doesn't work. It hasn't got the search function tool on there, but the GPhC have said it's going to be in the actual exam. Okay, so it will be a magnifying glass, okay, and it's going to be right before your zoom button. Okay, so on your PDF viewer, you are going to have like your little hand, you can have your magnifying glass, you can have a plus obviously to zoom in, and a minus obviously to zoom out. Okay, is that now clear for everybody and clears up any ambiguous thoughts or kind of like things that you've heard about the GPhC exam and search tools? Has that cleared it all up, guys? Give me a yes if it's cleared it all up. So this is why I'm teaching you 2 methods. So you've got understanding the structure of the SPC, so you know exactly where to look for that information, but you've also got that search tool. Fantastic. Okay, so SPC tips. Search smart, not hard. Okay, so if the question is asking you for a dose, search the indication. Okay, if a patient's having a STEMI, you search for a STEMI. If the patient's having a DVT, you search DVT. If the patient's having a pulmonary embolism, search PE or pulmonary embolism. Okay, often kind of like you have the abbreviations in the SPC, so you can just put PE, it will come up with your answer. Okay, if it's stable angina, type in stable angina. If it's hypertension, type in hypertension. It just brings you straight to the posology and administration. Okay, sorted. Okay, has that an EGFR been given? Okay, Has an estimated glomerular filtration rate been given? Okay, and you're not too sure if the dose is going to be affected by renal impairment. Okay, if you're not too sure, type in renal impairment. It will tell you. It will bring you to the renal impairment section. Okay, in your clinical particulars. Okay, if you're going to be having a question about if it's pregnancy or breastfeeding, type in those keywords: pregnancy or breastfeeding. Okay, if it's a side effect, you can either search in the side effect. Okay, so let's say, for example, if it was bleeding, you can type in bleeding and it can bring you down to that side effect section. Or, okay, you could just type in undesirable effects. Okay, and then it just brings you straight to that section. Okay, and the undesirable effects section is either going to be listed, which side effects are going to be common or uncommon, etc. It could have a table, for example, and it'll just bring you straight there. Okay, it's going to be about storage requirements. You search storage. Okay, I remember I had a GPhC exam in July, kind of like in my exam in July 21. Okay, and it was about insulin, and I was switching between different preparations of insulin. If I needed, and it was asking me what would a suitable dose be, I typed in switch, and it brought me straight to that section. Okay, so going through some quick questions. How did you divide the page into two on the screen? The GPhC says that it does it automatically. You don't need to be flicking between the two pages at all. It should do it automatically. Okay, and can you have both screens open for one resource and one for the exam at the same time? Yes, GPhC says that you can. Okay, so also, what else I was going to say about search tips? Okay, so if you're going to be having elderly patients, search elderly. Okay, search elderly. Okay, is there going to be dose adjustment in elderly? Okay, so sometimes if you have options, okay, if you copy and paste your options in, or kind of like the options that you have, okay, they don't necessarily come up onto the on kind of like in the PDF viewer, particularly if you need to be required to calculate a dose via the SPC. Okay, does that make sense, guys, about how you can search smart and not hard with SPCs? You search those key terms in the SPC to bring you straight to that information. If that makes sense, guys, and you're enjoying this session, there's over 200 of you on here this evening. Give me a yes if you are enjoying this session, guys. Give me a yes. Give me a yes if you're starting to feel a little bit more confident about SPC questions. Yes, we're getting some yeses, yeses, yeses. Okay, fantastic. Okay. Yeses, yeses, yes, yes, yes. Fantastic. Lots of yeses in the house. I don't want any more Michael Scott no's, okay? Even though I was rinsed a little bit about how the UK version is better. Of The Office. Okay, this is a lifesaver. Good, that's the whole point. Okay, you need to be doing SPCs the smart way, not hard. You don't have time to be going scrolling. You don't have time for that in the GPhC exam. Many students worry about the time aspects of the SPC questions, but you will find when you sit the exam, there's going to be some questions that you're going to be like, oh, I remember my first question in the GPhC exam is about dry cough, and I'm like, obviously that's ACE inhibitor, select. Okay, and then you build up time that way. Okay, I finished my exam with I think it's about 30 to 40 minutes to spare. Okay, I finished my clinical exam with 30 to 40 minutes to spare. Okay, and that's quite common as well. Okay, a lot of people finish the exam early, so you have got time to go through the SPCs if you're still a little bit worried about your SPC questions. You can flag those questions and come back to it. It's not a problem. Okay, I done it, checked the SPC answers. It was calm. Bob's your uncle. It was good to go. Okay, so what I now want us to do, guys, I want us to try and apply these strategies to actually help to build your confidence. Okay, so it's all very well telling me about the structure of the SPCs and kind of about how you can search smart and not hard. Okay, but I want you to apply the strategy. Okay, I want you to apply the strategy so you can see, oh, it works. I feel better about SPCs. Okay, so also in the description, guys, you will have the SPC for Clexane. Okay, can you give me a 1 if you have the SPC for Clexane up and running? Is there a search function for Calc SPCs as well? Yes, there's basically the PDF viewer doesn't change between the papers. Fantastic, getting some ones. Fantastic. Okay. How much time did I have left in Calc? I finished my paper in an hour. I redone all of my questions. I've redone them all because I was so sleep deprived that day. I just thought, oh my god, I'm gonna have to redo all of these questions just to make sure I didn't screw up on anything. And I checked my rounding as well. That's really important for the exam. Always check your rounding at Calcs. Just a top tip there. Okay, so we're getting some ones. Okay, so now that you have the SPC open, okay, guys, okay. Actually, I'm just thinking if I change my screen to this, is that clearer? Okay, is that clearer, guys? Let me get rid of that logo as well so it doesn't block some of the answers for you. So I'm hoping that you can all read the question nice and clearly, okay? Using the tactics, okay, either method 1 or method 2 for the SPC, okay? This is the GPhC example question, okay? I wanted us to go through as a two GPhC sample questions. We've got a mini quiz at the end, and I'm going to have my little motivational speech for you guys at the end as well. I want you guys actually to apply these strategies to this question, okay? So go ahead, search for it, guys, okay? And when you're ready, pop your answer into the chat and we're going to go through this, okay? Because we need to practice you to actually apply the strategies to the questions, okay? I'm going to shut up now and let you get on. Okay, guys, I'm going to give you about 30 more seconds, roughly, and then we're going to go through this question about applying the strategies that I have just taught you. Okay, fantastic. We're getting some answers through, guys. How are you finding it? Are you finding it better now that you've got the strategies of a method 1 or method 2? Are you finding it easier to navigate through these two methods? Okay, fantastic. We've got 75. We've got 75 milligram BD, 75 milligram BD. Haley is on fire. Yes. 75 milligram BD, 75. Okay, 75. Yes, fantastic. Okay, the strategies are helping. It's amazing. Thank you. No problem. That's my job. I'm here to support you guys always. Okay, so in terms of kind of like how I always tackle my SPC questions is that I highlight the key information. Okay, we know that Clexane is always going to be kind of like in terms of a milligram per kilogram basis. So I highlight patient age, weight. Oh, the patient's got renal impairment. That's important. Okay. We got ST segment elevation. That's what they've got. And we want to find out the first 2 subcutaneous doses. Okay. Can I show it on the SPC? I have taken screenshots because I don't think it's going to let me to double share screens, if that makes any sense to switch. So I've taken some screenshots. Okay, so in terms of highlighting the key information, okay, so the question is asking you about a dose. Okay, so if you actually just want to navigate straight through, you can go down to the clinical particulars, okay, and then you're going to go onto your posology and administration. Okay, silly question, but is there a highlight tool in the exam system? It is not a silly question, and yes, there is. It's up to you whether you want to use it. And even with the Surpass system, you even have the option to change the background of your exam. You can change to black or blue or pink if you fancy, but you can change the color of your exam thingy as well. Okay, so in terms kind of like of acute coronary syndrome, okay, we've talked about NSTEMI and STEMI. We're going to go down to the therapeutic. We're going to scroll down to clinical particulars. We're going to go down onto posology and administration. We know essentially we go down here, we're looking at doses, but it says for dosage information, okay, for those over the age of 75, we're going to go over to our elderly. Okay. What you could have done in terms of your search terms, okay, if you search STEMI, it would bring up this section of the SPC. Okay, even if you search elderly, it would have brought this section up first, then essentially the elderly section, which I'm going to show you next. Okay, then essentially when you go to the elderly section, it tells you obviously patients obviously with a STEMI, elderly over 75 years or over. Okay, the dose is going to be 0.75 milligram per kilogram every 12 hours with a maximum of 75 milligrams. Okay, we know from the question the patient weighs 120 kilos. Okay, we have it highlighted 120 kilos here. Okay, so that actually comes to 90 milligrams BD, but it says maximum of 75 milligrams twice a day. That is going to be kind of like the maximum dose that the patient can have. Okay, and if you wanted to check about renal impairment, you can literally just type in renal impairment and it will come up about renal impairment in the exam. Okay, so essentially, if you look at the renal impairment, okay, it will go moderate and mild renal impairment. It says no dose adjustment is going to be needed. Okay, so therefore, the correct answer here, guys, well done to all of you. You've got it correct, and that is going to be 75 milligrams twice a day. Okay, does this make sense, guys? Okay, are you feeling better about SPCs? Give me a yes. Are you feeling better about SPCs? Give me a yes. Give me a yes. We're going to go through one more example of a GPhC style question on the sample questions, and then we're going to go through a quiz, then a motivation. Okay. So in the exam, will this automatically come up side by side? The GPhC says it will. Okay, the GPhC have also released a video about how to use Surpass. Worth looking at that video too. Okay, lots of yeses, yeses, yes, 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 yes. Lots of yeses in the house. Fantastic. I'm glad you enjoyed this session, guys. Okay, you're going to be killing these SPC questions. You're going to be like, SPC, no problem. Absolutely no problem, mate. Yes, lots of yeses. Fantastic. Okay. Okay, so what age is considered an elderly patient? In this question, the SPC said it was 75 years or older. I could just quickly show that to you guys. It says, for treatment of acute STEMI in elderly patients greater or equal to 75 years of age. So in this question, they stated elderly was 75 years of age. Okay, so let's go through one more GPhC sample, then we're going to go through kind of like this one more question here, guys. Okay, so you can practice applying those strategies that I have just taught you, and then we're going to go through like a little mini quiz. Okay, just a light-hearted mini quiz just to get you used to navigating the SPCs. Okay, so guys, I'm going to shut my mouth and I'm going to let you crack on with this question. And when you're ready, pop your answers into the chat. Okay, you will smash this. You will get it. You're absolutely killing it so far, guys. You're going to do exactly the same thing in your exam. Fantastic, fantastic. We're getting some answers through, guys. We're getting answers through. Any other answers, guys? Any other answers? Fantastic, fantastic. Okay, so, okay. Is Mariam says it's 80 milligram BD. Chelsea says it's 80 milligrams BD. Haley says 80 milligrams BD. Maria says 80 milligrams BD. Fantastic. Okay, 80 milligrams BD. Fantastic, fantastic. Okay, well done, guys. That is the correct answer. Okay, so what you could have done, okay, if you're just simply going through the navigation method, we're going to go to clinical particulars, then straight to pathology administration. We look for DVT and PE, and the answer is going to be in there. Alternatively, you could have just searched the indication through our key search terms that we discussed, type in PE, boom, that's you can see that's exactly what I've done in this screenshot here, and it brings you straight down to this page, okay? So, okay, it tells you that it's going to be essentially 1 milligram per kilogram twice daily, should be used in all patients, such as those with obesity and symptomatic PE. Patients got symptomatic PE, okay, that's it, it's 80 milligrams twice a day because the patient weighs 80 kilos. Okay, fantastic, guys, okay. Well done. The correct answer is 80 milligrams. 80 milligrams. Okay, let's get my face back up on here. Oh, not that button. Okay. Fantastic. Okay. Who is ready for a nice little light-hearted quiz? Okay. Nice little light-hearted quiz before I go on to my little motivation speech, guys. If you are ready, give me a quiz or give me a yes, give me a boom, because we are going to be smashing these SPCs. Okay. For the quiz, I want you to keep open your Clexane SPC. Please keep open your Clexane SPC. The quiz is going to be based on the Clexane SPC. The aim of the quiz is just something lighthearted, a little bit of exercise, okay, just to get you used to navigating it. Fantastic. Maria goes boom. Maria goes boom. Torsif goes boom. Yes. Tammy says quiz. Yes. Boom, boom, boom. Fantastic. Okay. So, guys, do you still have your SPC up for Clexane? Do you still have it up? Do not close it down because the quiz is going to be based on the Clexane SPC. Okay. So, you guys all seem to be ready. Okay. So, what is the frequency of the following side effects? What is the frequency of the side effect alopecia? So whatever method feels more comfortable for you guys, we're going to search by key term, okay? So you can search by undesirable effect, for example. You can search by the side effect, okay? I want you to tell me what is the frequency of alopecia as a side effect. Fantastic. You're killing us super quick, guys. We're getting rares, we're getting rares, we're getting rares, we're getting rare. Fantastic. It's going to be rare, 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 rare. Boom. Yes, rock it because you are super quick. Loving it, loving it, loving it, loving it. Ah, you're just on fire. Absolutely just on fire. Okay, between 1 and 10,000 and 1 and 1,000. Okay. So, injection site pain, okay? Injection site pain, what is the frequency of this side effect? What is the frequency of this side effect? Okay, we're getting common. We're getting common, we're getting common, we're getting common, common. More common. You are super quick at this, guys. This is fantastic. This is exactly what it's going to be like in a GPhC exam. You're getting used to searching by your key terms, okay? Getting used to searching by your key terms. Frequency of side effects is a nice SPC question to come up in your paper 2. Fantastic. Common, common, common. Fantastic. Okay. Osteoporosis. What is the frequency of osteoporosis? What is the frequency? I've had too much caffeine. Straight away, we are getting answers through. Straight away, it's going to be rare. It's going to be rare. Fantastic. Fantastic. Rebecca says rare. Fantastic. Maria says rare. Fantastic. Okay. Exactly. You are all going to smash this exam. You are all going to smash the exam. Okay. You are absolutely killing this. Okay. Just a nice little, you're killing this. It's a light-hearted quiz. It's the same exercise that you're pretty much going to be doing in your exam. Searching those key terms. Okay. Or looking straight down to the undesirable effects section in the SPC. Okay, fantastic. So we've got alopecia rare, injection site pain common, and osteoporosis is going to be rare. Okay. Which of the following is going to be a contraindication? Is heparin-induced thrombocytopenia a contraindication with Clexane? We're getting yes. We're getting yes. Fantastic. Of course it's going to be. Okay, you're all just probably just thinking, I don't need to look in the SPC for this. Heparin-induced thrombocytopenia. Of course it's going to be a contraindication. What on earth are you talking about? Okay, if someone has heparin-induced thrombocytopenia, we don't just go giving him more Clexane on top. We don't do that. Okay. What about spinal anesthesia? Is that a contraindication? We're getting yes. We're getting yes. We're getting yes. Okay, you're just thinking, obviously. Yes, 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 yes. Okay, lots of yeses. Lots of yeses. Okay. So with spinal anesthesia, okay, it can't be given within a certain time period with Clexane. I believe it's 24 hours, if I remember correctly. Okay. So obviously, if you've just given spinal anesthesia, you don't give Clexane on top. Okay. So if we had a creatinine clearance of 40 milliliters per min per 1.73 meters squared, does that mean Clexane is going to be contraindicated with a patient? Okay, we're getting no. Okay, we're getting no. Why? At what point, at what renal function do we go, absolutely no Clexane for you? No Clexane for you if you had what renal impairment? What would at what point in terms of yes, yeah, okay, the cutoff is going to be 15. The cutoff is going to be 15. Cutoff is 15. Fantastic, fantastic. Well done, well done. Awesome. Okay, absolutely killing this. Okay, fantastic. Okay, so what is the dose for prophylaxis of venous thromboembolic disease if a patient has a creatinine clearance of 23 milliliter per min per 1.73? Okay, we're getting some answers through. We're getting some answers through. Okay. Okay, so we're getting 20 milligram once daily, 20 milligram once daily. Okay, 2000, I'm assuming you mean international units. Yeah, 20 milligram once daily, 20 milligram once daily, 20 milligram once daily. Okay, where did you find this information? You're all saying to me 20 milligrams once daily. Where did you find it? Which part did you scroll down to? Which part did you go straight down to in the SPC? What was the key terms that you searched? Fantastic. You just searched renal impairments and it gave you the beautiful table. How quick and easy is that? How quick and easy is that? Fantastic. You scroll down to 4.2. Fantastic. Yeah, you can just search renal. Yeah, you can search down renal, brings you straight down there. It's all about searching smart, not hard. Okay? Fantastic. You've searched down to pathology and administration under renal impairment. Beautiful. Spot on. Absolutely. Fantastic. Fantastic. The correct answer was 20 milligrams once a day. Yes, fantastic. There is a table. The table is beautiful, isn't it? It makes your life a lot easier in terms of these SPC questions. You will see questions like this in your exam. Okay. What is the shelf life of Clexane? What is the shelf life of Clexane? So let's say, for example, I am, if you're part of the OTC MEP class, you know that I use Mr. Gohill for everything. King Cameron, I use him for everything. He's a patient of every single disease. So let's say King Cameron, i.e. Mr. Gohill, comes into your pharmacy and he shows you an old box of Clexane, but he does not know what the shelf life is. Okay, what is the shelf life? Okay, 2 years. Okay, fantastic. Katie says 2 years. Fantastic. Maria says 2 years. Fantastic. Rebecca, fantastic. Torsi, fantastic. 2 years, 2 years. Michael says 2 years. Fantastic. Okay. So, fantastic, guys. Okay. Which route of administration should be avoided with Clexane? Fantastic. Getting answer straight away. So Shilpa says, IM. Yes, we're getting intramuscular. Ahmed says intramuscular. Nicole, fantastic. Tony, fantastic. Fantastic. All saying intramuscular. Fantastic. That is the correct answer because patients who have acute STEMI, we can actually give Clexane intravenously initially, and then we can put them onto a subcut route afterwards. Fantastic. Okay, so here comes my motivational speech. Okay, I hope, first of all, I hope you found the session useful. Okay, if you feel more confident, okay, about SPCs, give me an SPC in the chat. If you feel more confident about them, give me an SPC in the chat. If you're ready to smash out the SPC questions, okay, if you're ready to smash those SPC questions in the exam, just type an SPC in there. Okay, give me an SPC if you're feeling much more confident. Okay, but yes, lots of SPC, 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 SPCs in the house. There's loads. Fantastic. Okay, I hope you found the session useful. Okay, and the most important thing here, guys, is to believe in yourself. Okay, you can do it. Okay, I believe in you. Everyone at Pre-Reg Shortcast believes in you. You will do it. You will smash it. It is so easy to overthink the GPhC exam. Okay, I certainly was in that position. I cried and I cried and I cried over the GPhC exam. I was an absolute mess. I looked like a zombie from Walking Dead walking into that. And I swear the people at Pearson View, okay, were probably just thinking, oh my God, who is this woman? She doesn't look like anything like her passport. Okay, but okay, I got through it. I had no sleep. Okay, I was a mess and I still got through the exam. Okay, I still got 100% in counts, 98% in clinical. You were all clever. You all got through 4 years of university. Okay, you all got through 4 years of university. Okay, you just got one final exam. Okay, one way to remember it. Okay, at university you had lots of different exams, right? You had lots and lots of different exams. Okay, so for instance, I had FAM 1125, or I had FAM 1126 and FAM 1127, FAM 1128. Okay, honestly, you had so many exams at university and you got through it. Okay, If you just think about it, you had a calculations exam every single year. It's just another calculations exam, okay? Depending on which university you went to, I had a BNF MCQ kind of an exam, particularly in year 3 and year 4, okay? So essentially kind of like I just treated it like that. How did I keep calm and convince yourself that you can do it? Honestly, I was not calm. I was a mess. I was an absolute mess, okay? But it's only when I look retrospectively, okay? Only when I look retrospectively, okay, I go, oh my God, the exam wasn't that bad. I had nervous breakdowns. I was crying. Okay. And all honesty, to this day, I know my dad is watching this. Okay. Both my mum and dad and Cameron have all supported me throughout my journey to become a pharmacist. Okay. All of them were standing outside my exam and says, get your backside up there and do the exam, because I wanted to defer my exam to November and not sit it in July. They told me to get up there and just do it because I was prepared. I just didn't believe in myself. Okay. So I am here to tell you that I believe in you and you can do it. Okay, you've graduated, you've passed. Okay, you are going to become pharmacists. It's not if you pass, it's when you pass. Okay, your results come out on the 28th of July, so you will have those results on the 28th of July, and it's going to say, congratulations, you're a pharmacist, you've passed. Okay, and on all honesty, when you're sitting there, I was in the same position as you 2 years ago. You sit there and you think, what on earth is this girl talking about? Okay, I'm a nervous wreck. It's horrible. I'm so anxious. I'm just, kind of like, it's horrible. The feeling of palpitation, even if you rest, sometimes I have the palpitation of, oh my God, I'm not revising. Why am I not revising? I should be revising. I shouldn't be sitting down watching. I shouldn't be sitting down and watching TV. I should be revising. Okay. And it's like the unconscious guilt just keeps on building up and building up and building up, but you will pass. You're perfectly fine. You will pass. You are all so clever. Okay. And in all honesty, if I can do the exam like a walking zombie, okay, all of you will pass with flying colours. My epilepsy paper was amazing. It helps me with my thesis. Ah, you had Dr. Thomas. Next time you see Dr. Thomas, tell her I said hello. Fantastic lecturer at Medway. But in terms of, okay, you will pass, okay? You will pass. It's not a matter of hope. You will pass, okay? You've done 4 years of university. Okay, you've got a master's degree. For goodness sake, guys, you've got a master's degree. You will pass. You will pass, okay? If I was a betting lady, I'll be betting money on this, okay? How similar did I find mock exams compared to the real exam? Harder. Honestly, I found the mocks harder than the real exam. I was with Buttercups during my training year. I found the Buttercups mock a lot harder, and Pro Pharma's actually a lot harder than the actual exam was. Is it safe to say that you would never feel ready for the exam? You should feel ready. It's a natural feeling that you don't feel ready, okay? Because sometimes the more you look at things, you go, oh my God, I don't know it, I don't know it. But you have to remember the GPhC does not expect you to be a walking BNF. Okay? GPhC does not expect you to be a walking BNF. Okay? The whole paper, you look at the clinical paper and you go, oh my God, why was I even stressing? Okay? It's asking you questions about what the best practice is going to be. Basically, the paper is, the GPhC exam is basically seeing if you're going to be safe to be a pharmacist. You're all going to be safe to be the pharmacist because you've just done a year of training in your training locations, whether it's hospital, community, GP, industry. You'll absolutely smash it. I guarantee you'll absolutely smash it. And now is the time for you to actually build up your confidence to say, you know what, I can do it and I will pass. Okay, I've got this far. I've only just got one more exam left. Okay, and everything that I have worked for will be worth it. Okay, so good luck in your exams. You will be fine. You can do this. 100% you can do this. You definitely will. And honestly, I am telling you now, you will not realise that the exam isn't that bad until you actually kind of like get out the other side. Okay. And the most important thing is when you actually start walking in there, I was having palpitations going boom, 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 right? Okay, I had to do some breathing exercises. Okay, deep breaths in, deep breaths out to try and slow my heart rate down. Okay. Okay, because if you're stressed, the cortisol levels shoot up, okay, and it shuts off your prefrontal cortex. You need to do those breathing exercises, okay, to calm yourself down, okay, then everything will start flowing out naturally, okay. Oh, thank you. But guys, no, seriously, you will do it, okay. You'll 100% get there, okay. You will always, you're just going to do it. You're so clever, all of you. You've got through your master's degree. You're going to get through this. Okay. So I hope you found the session useful, guys. Okay. Remember, exactly. Think of it like another mock. You've done lots of mocks. Think of it like another mock. And this is so true. Okay. More students always pass than fail. Okay. And it's true the exam is not as bad as the mocks. The questions are always very clear. The GPhC do not expect you to have a crystal ball. You've probably seen some mock papers. You think, oh, that question wasn't very clear. Okay, the GPhC will make it very clear. They even tell you there is a resource pack provided for you. That's how clear they are. Okay, that is how clear they are because they cannot afford any ambiguous questions. Okay, so if you have any other questions in the last minute or so, throw them at me. Okay. I hope this has actually helped you boost your confidence, okay, for the GPhC exam, okay. You will get there. You will be fine, okay. Hope you all enjoyed the session, guys. Hope you all enjoyed it, okay. Considering that it's 9 o'clock, okay. Don't know what your revision schedule is like. It might be worth having a nice night's sleep. Okay, sleep is so important. My cocktail for the exam was, I wish I had sleep, okay, but I used to take multivitamins. Okay, methadone tonic doesn't never seem to be kind of like methadone tonic doesn't seem to be around anymore. I was probably so crazy because of the petrol in it, and kind of like but it's essentially kind of like boosted their own version. You've got Floridix. Okay, I used to take glucose tablets for the exam. Glucose is really good for brain metabolism, and so is omega-3. Okay, and I had lots and lots of caffeine. Okay, did you ever go brain dead sometimes? Yes, 100%. And I used to beat myself up so much about it as well. I used to beat myself up so much about going brain dead. It's because your brain goes to an information overload, okay? And your short-term memory is going, nope, I don't want to play today. But, okay, it is normal. You need to take regular breaks. Regular breaks is important. Information overload, information not going to go in, okay? Oh, I definitely feel you about stress-induced insomnia. Definitely. Definitely. I bought that methadone working wonders for me. Fantastic. No, it's really good stuff. I love it. It tastes disgusting, but I love it. Okay. You will get there, guys, and make sure you have plenty of rest, plenty of sleep. If you suffer with insomnia like me, okay. I used to buy Nitol over the counter for short-term insomnia for kind of like during the exams. Okay, I used to try and go on like doing like yoga, or there's like some YouTube videos that kind of like I used to kind of like listen to. It's about kind of like, it's all kind of like this yoga stuff, and it's about kind of like getting your mind to reset in order to get you kind of like to relax before going to sleep. It worked every single time for me, apart from the night of the GPhC exam, but that was just a stressful day in itself, and that was induced by me and nothing else. Okay, so you will get there, guys. Remember, you will get there, okay? You will get there. Good luck. You will smash it, okay? Show the GPhC who's boss. You're all going to be pharmacists, and you're going to kick some backside with those SPC questions, okay? So good luck, everybody, okay? Good luck. You'll be perfectly fine, and you will pass, okay? See you later, guys.